Hello, welcome to OSA's Vincent Educational Healthcare Tips Talks. Today, we're going to be talking about asthma. I know so many of you know about asthma, but I don't know if you know how dangerous and life-threatening asthma can be. Acute asthma is a life-threatening condition, especially when in a stage of exacerbation. Asthma is a very life-threatening condition it presents. Patient to emergency department, all the time it comes with acute shortness of breath, chest tightness and coughing after exposure to secondhand smoking. So today, I'm going to be explaining to us the risk factors of asthma, so we will be able to protect ourselves and our children. I'm going to be talking about asthma in adults and in children. One of the risk factors for asthma is genetic predisposition, which is family history. They have an asthma allergy, eczema. They have exposure to triggers, e.g. You have a child with asthma and your husband smokes. You smoke, they become secondhand smokers, placing them to have a risk factor to asthma. Viral infection, allergen, so these are all risk factors. So how do we know when somebody has asthma? These are some of the clinical manifestations that you need to pay attention to. Some people, their family members might have asthma attacks and they don't even know. They think the person is just having something else, don't really understand what the person is having. So some of the clinical manifestations you need to understand it, because I've seen people pass away just because they have asthma attack and the right was or treatment was not given on time. The right procedure was not being followed and they still live around people who are smokes. These are triggers that trigger the asthma attack in them. Clinical manifestations of asthma are things that trigger asthma. No things that you need to look for is number 1, shortness of breath. When somebody is having an asthma attack, they will be having shortness of breath, meaning they can't breathe properly. They will be gasping for air. They will be wheezing. You will be hearing it very loud, hearing wheezing sound because their chest has tightened and the air cannot pass through. They will be coughing there. B will be wheezing on auscultation. During assessment with the nurses or the doctor, when you take a stethoscope, you listen to the lungs. You hear wheezing on auscultation. Wheezing on auscultation, their chest is tight and the air is trying to force through so that they can breathe, and if medical emergency is not being done, the person can just pass away. They have increased respiratory rate. Their respiratory rate will be increased. They breathe very fast and their heart rate is very fast, but they are still short of breath. They have low oxygen saturation, which is expected anyways, because if they can't breathe, the oxygen cannot go into their lungs. It cannot circulate, so they're going to definitely have low oxygen saturation, and if anything is not done, the person will turn blue and that will be the end of it. Asthma is a respiratory distress condition and can lead to a whole lot of complication, and it can lead to the person passing away. In any family there, if the child or the adult lives in an environment where they smoke, if there is a frequent triggers in the environment, maybe dusty environment, maybe they have a dog, they have a cat, they are allergic to things that is triggering those things that is causing those asthma. So physical exam is going to be done when the person come to the emergency department or when they go to the doctor, the healthcare provider. We check their vital sign. He will check if the patient present with wheezing, which I talked about wheezing, they have a narrow passage in their lungs is narrow, and there is no air going in and out. They have low oxygen respiratory efforts. We check on that as well. Respiratory effort is how is their breathing. Are they having labored breathing? Labored meaning they are struggling to breathe at the same time. Their breathing rate is very high and their heart rate high, but they are short of breath. They are having labored breathing. Respiratory effort, and they have this accessory muscle they use, trying to breathe with their accessory muscles in their shoulder. Their lungs, everything is just popping out and you're seeing the struggle in that person. A lot of children go through this asthmatic episode issue and asthmatic attack, and it's very dangerous, especially for children. Sometimes they can't really explain what they are going through. They can't really tell you what's going on. So with the pediatric population, is very, very difficult to diagnose. With the family history and other risk factors, we'll be able to find out what's really going on, so the child will be treated. The diagnostic test that is being done is called spirometer to access the lungs function. So what they do, they give them something to put in their mouth and ask them breathe in and out or to blow the FEV. So what this test does is they are trying to see the ratio of the volume of how you can blow your respiratory, like how you can blow, the capacity of your lungs can carry. So they use it to access the person, also so the flow volume of the air that is going in and out of your lungs. Also do a blood work, which is blood gas analysis to assess severity, and also to check for respiratory acidosis. Respiratory acidosis are very common with people with asthma. So what do we do if the person is diagnosed with asthma? Then we have to plan care. This is where I really want families, mothers and fathers and adults to really pay attention to. Plan of care for families if you have a kid, if you have a husband, if you have a wife that is going through asthma. Respiratory attacks, acute treatment is key. They usually give them nebulizers treatment with a short-acting or better antagonist, which is the medication like a puffer, such as albuterol, to open their airways. Okay, I know that's a whole lot of medication right there. But this is the most common medication that is being used for asthma acute condition. So they use it as a puffer inhaler. So one other thing is to have in mind whatever medication that you've been given for this asthma condition, it is very important you know the proper use of it. Because some people, when they give them puffers, they are not sure of the proper way use the spacer and puffers, they don't inhale it properly. So being able to understand how to use it will be of a good treatment plan to that person. So acute treatment is following the proper treatment plan that the doctor has given. So the PAT can get relief inhaler for quick relief of breakthrough symptoms. So if somebody is having an attack right now, they have a quick inhaler they can take for treatment also. Underlying conditions will also be assessed. The doctors also look into underlying conditions like allergic and sinuses, which can trigger the asthma. They look into environmental control to measure and avoid triggers. If the child or the adult is living in an environment where there are pets or adults smoke, or the parents of the child smoke, it has to be stopped, or the parents can smoke outside. Very important. That is what I'm saying. Education on proper inhaler technique is very important to the medication regime. So I wanted to talk about this asthma because I've seen a whole lot of things going on with people having respiratory issues. Asthma attacks and they don't know exactly what to do. Their families, their friends, their children have respiratory acute asthma issues, and they end up with a whole lot of problem. So I always promote and encourage patient education with most of my clients. Most of my patients I do take care of in the emergency department, and number one thing I tell them is proper use of the inhaler and the spacer. Is very important of consistent use of the controller of the medication to prevent asthma attacks. Identifying and avoiding personal asthma attack. These are very important. Asthma trigger. If you know what triggers your asthma, don't go to that environment. Also, you need to know when to use the relief inhaler and when to seek for medical attention and medical care. I just wanted to touch base about this little teaching about asthma and how you can manage the triggers and how you can use your inhaler and your spacer. Thank you so much. Please distribute this video so that others can learn. A lot of people have asthma is a very common condition and diagnosis. People do get it all the time, but most people don't know how to really take care of it, and they end up in a more dangerous situation. Thank you so much for watching. Distribute, and I will see you on my next episode. This is OSA's Vincent Healthcare Tips. See you later, and bye-bye for now. Please list all the risk factors of asthma and their treatments and triggers.